Welcome to the deep dive. We often hear about things like swelling down there. And today we're going right into one of the pretty common reasons for that, hydrocele.
hmm
It's one of those terms maybe you've sort of heard of, but let's really get into what's actually going on.
Exactly. And think of this as, well, your quick guide to really understanding hydrocele. We've looked at hydrocele, definition, diagnosis, and management, and basically pulled out the key stuff.
Right.
So you get a clear picture, but without, getting totally bogged down in detail. The idea is just to make the essentials stick, whether you're revising or just curious.
Okay, great. So let's start right at the beginning. If someone mentions hydrocele, what exactly are we talking about?
Simply put, a hydrocele is just a buildup of fluid. It's in the tunica vaginalis, which is, well, the sac that surrounds the testicle.
Okay.
And remember, it can be something someone's born with that's congenital, or it can pop up later in life, which we'd call acquired.
All right, this tunica vaginalis.
hmm
So where is this fluid, actually collecting?
Okay, imagine the tunica vaginalis has two layers,
Oh.
almost like a double-layered bag. You've got the visceral layer right up against the testicle,
Mm-hmm.
and then the parietal layer just outside that, the hydrocele fluid. It sits right in that space between those two layers.
Got it. So the testicle is sort of floating in this little fluid pocket. Now, you mentioned congenital and acquired, but the source material also talks about communicating and non-communicating hydroceles. What's the key difference there?
Yeah, that's important. Think of it like this. A communicating hydrocele, which you see more often in children, means there's still a small open pathway. It's called the processus vaginalis,
Okay.
and it connects the scrotum back up to the abdomen from when the testicles originally descended. So fluid from the belly, peritoneal fluid, can actually drain down into the scrotum, like a little continuous flow sometimes.
Ah, so a direct connection.
Exactly.
Okay.
Now, it's less common in adults, but it can happen maybe if there's increased pressure in the abdomen pushing fluid down.
Okay, that makes sense. And the non-communicating type then?
Right. So with non-communicating, that pathway, the processus vaginalis, it's closed off properly.
Oh.
The fluid builds up just because the tunica vaginalis itself is either, well, making too much fluid,
Mm-hmm.
or it's not absorbing the fluid that's normally there very well. And often there isn't one clear cause. It might just be a reaction to some local irritation or inflammation maybe.
Now, here's something that jumped out at me. Hydrocelses can sometimes be secondary to other problems. Why is that significant?
Oh, that's a really crucial point, especially for diagnosis. A hydrocele might not be the primary issue
On
itself.
tape, okay.
It could be a sign that something else is happening, like an infection epididymoorchitis,
Hmm.
that's infection of the testicle and the tube behind it, or testicular torsion, a twisted testicle.
Which is an emergency.
Absolutely emergency, or even sometimes a testicular tumor. So it really highlights why any new scrotal swelling absolutely needs a proper checkup to rule out these more serious possibilities.
Okay, so we know the what's. Now, why does this fluid imbalance happen? What's the etiology, the cause?
Well, fundamentally, like you said, it's that balance being off, either too much fluid being made or not enough being soaked back up by the tunica vaginalis. That's the core issue.
And for those congenital ones in baby boys, what's the main driver there?
For the congenital type in males, the key cause is that pathway staying open, the patent processus vaginalis. Just think patent means open.
Open for business, letting fluid down.
Pretty much, yeah. Allowing that abdominal fluid to find its way into the scrotum.
And what about in females? The source mentions them too.
Yeah, it's less common or maybe just less talked about, but females can get similar fluid collections along something called the canal of Nuck. And these can also be congenital or acquired, kind of mirroring the situation in males.
Interesting. Okay, so who's more likely to get a hydrocele? What are the risk factors we should maybe keep in mind?
Generally speaking, older age is a factor. They tend to become more common as men get older. Also, things like scrotal trauma, getting injured down there, can sometimes set one off. Infections in the scrotum or even having had a hernia before. Basically, anything that messes with the normal fluid production or drainage in that area can increase the risk.
And for the congenital hydroceles, the ones babies are born with, any specific risks there?
Yes, there are. Being born prematurely, having a low birth weight, and sometimes even a family history of hydroceles seem to make a congenital hydrocele a bit more likely.
And for the acquired ones, the ones that develop later on?
For acquired hydroceles, well, things like inflammation or infection in the scrotum, like we mentioned, are definite risks.
Right.
Having had previous surgery in the scrotum can sometimes be a trigger too. And interestingly, sometimes conditions that cause general fluid retention in the body, think heart failure or severe liver disease can also contribute to a hydrocele developing.
Okay, so we've got the definition, the why, and who's at risk. Let's go a bit deeper now into sort of the biology of it, the pathophysiology.
So the core mechanism, again, is that imbalanced fluid production versus fluid absorption right there in the sac around the testes, or ovaries in females along the canal of Nuck.
Right, the imbalance.
In the congenital case, it's that persistent connection, the patent processus vaginalis, acting like a leaky pipe from the abdomen down into the scrotum.
Allowing that peritoneal fluid to collect.
Exactly. But with the acquired type, the problem is more local, right within the tunica vaginalis itself. Either the cells lining it start making too much fluid,
Okay.
or the system that normally absorbs the fluid just isn't keeping up.
And the result is the same either way.
The end result is, that characteristic painless swelling. Usually in the scrotum, but sometimes it can feel like it extends a bit up towards the groin too.
Okay. Now, if someone presents with swelling, how do you figure out if it is a hydrocele and not something else? What are the main things on the differential diagnosis list?
Yeah, this is super important, avoiding misdiagnosis. Several things can look or feel like a hydrocele. An inguinal hernia, for instance.
Where bowel pushes through.
Exactly. Part of the bowel pushes into the groin or scrotum, causing a bulge. Then there's a varicocele that's enlarged veins in the scrotum. People often say it feels like a bag of worms.
Okay, definitely sounds different. What else?
Well, crucially, testicular torsion. We mentioned it before. The testicle twists, cuts off blood supply. It's an emergency, and the key difference is usually intense pain. Remember, hydroceles are typically painless.
Pain is the big red flag.
It really is. Also, epididymitis, inflammation of the epididymis, that usually hurts too.
Yeah.
And finally, and this is vital, you always have to consider testicular tumors.
Right.
Even though they might be painless at first, any new scrotal mass needs checking to rule out cancer. You just can't miss that.
So a simple painless swelling isn't always simple. That's a really key point. How common are hydroceles then? What's the epidemiology look like?
They're actually pretty common, especially in older males. For newborns, the numbers suggest maybe around 6% of full-term baby boys might have a noticeable hydrocele after the first few days of life.
Wow, 6%. That seems quite high.
It does, yeah. Then in adults, the causes are more mixed. Could be infection, trauma, maybe a tumor, or some other underlying health issue triggering it.
And the females with the canal of Nuck fluid?
Yes. Females too, though maybe discussed less often. Similar fluid collections can happen there.
Okay, so we know what it is, why it happens, who gets it. What are the actual signs someone might notice, the clinical features?
The absolute main thing is painless swelling, either in the scrotum or sometimes feeling like it's in the groin area. Think painless fluid pouch.
And the swelling itself. Any characteristics?
Well, the size can really vary, from quite small to very large. And the classic bedside test is transillumination.
The flashlight test.
Exactly. You shine a bright light like a pen torch behind the scrotum in a dark room. If it's mostly fluid, like in a hydrocele, the light should pass through, giving this sort of reddish glow. But it's not 100% definitive, Some other things might transilluminate a bit, and sometimes a hydrocele might not if the fluid is cloudy or the wall is thick. So it's a clue, but not the whole story.
Got it. A helpful clue, but needs confirmation. What about those communicating hydroceles in kids? Anything specific to look out for?
Yes, definitely. Because of that connection to the abdomen, the size can change.
Fluctuate.
Exactly. You might notice it seems bigger at the end of the day, maybe after the child has been running around, and smaller in the morning after they've been lying down flat all night. Gravity plays a role.
Makes sense. Fluid drains back up. And for the non-communicating ones in adults?
Those tend to be more constant in size. Often the person can't really pinpoint when it started or what might have caused it. It's just there.
Are there any other feelings associated with it besides the swelling?
Sometimes, if it's quite large, people might feel a sense of heaviness, maybe a dragging sensation in the scrotum, just from the weight.
Okay.
The size might fluctuate a bit, even in non-communicating ones, but rarely is there actual discomfort or pain. And like we keep saying, if there's pain, that's a signal to look harder for an infection or some other cause.
Painless swelling is the hallmark. Pain is a warning sign. Got it. So how do doctors actually confirm it's a hydrocele? What are the investigations?
Well, it really starts with the basics. Taking a good medical history, asking about symptoms, and doing a thorough physical examination of the scrotum.
Including the transillumination we talked about.
Yes, exactly. Physical exam, transillumination, those are the first steps. But if there's any doubt, or importantly, If the doctor can't properly feel the testicle itself because the swelling is too big or tense,
Then what?
then an ultrasound is usually the next move.
And what does the ultrasound show? Why is it so useful?
Ultrasound is great because it uses sound waves to give a really clear picture of what's inside the scrotum. It can easily confirm, yes, there's fluid consistent with a hydrocele,
Okay.
but you can also check the testicle itself, make sure it looks normal, rule out a tumor or other masses, and it helps tell the difference between a hydrocele and, say, a hernia or a varicocele. Plus, it avoids having to stick a needle in just to see what comes out.
Right, less invasive. What about blood tests? Are they ever used?
Not really for diagnosing a simple hydrocele itself, but if the clinical picture makes the doctor worried about a possible testicular tumor, then certain blood tests looking for tumor markers might be done.
Okay, so primarily exam, maybe ultrasound. Now the important bit, how are hydroceles actually managed? What's the treatment?
It depends. For infants with those congenital hydroceles, because so many of them just resolve on their own within the first year or maybe two.
As that pathway closes.
Exactly, as the processus vaginalis closes naturally. So the usual approach is just watchful waiting, observation, just monitor it.
Good to know. Watch and wait for babies. What about in adults? Do they tend to go away by themselves?
Much less common in adults. Spontaneous resolution is rare. So if an adult hydrocele is causing bother, maybe a discomfort, it's very large, it affects their daily life, or they don't like the appearance, then surgery is often the way to go. That's called a hydrocelectomy.
Surgical removal. Are there non-surgical options for adults?
Yes, there are alternatives. For some adults, especially if it's a non-communicating type and it really isn't causing much trouble, just keeping an eye on it, conservative management can be perfectly reasonable.
Okay.
Another option, mainly for those who might not be fit for surgery, is aspiration and sclerotherapy.
How does that work?
Well, first you drain the fluid out with a needle, that's the aspiration. Then you inject a special substance, a sclerosant, into the empty sac.
What's that do?
It basically irritates the lining of the sac, causing it to scar up and stick together, hopefully preventing the fluid from building up again. It's not always permanent, though, and might need repeating.
So aspiration and sclerotherapy is mainly for people who can't have the surgery.
Often, yes.
Yeah.
Or for those who prefer to avoid surgery, understanding it might not be as definitive.
And are there any pills or medicines for hydroceles in adults?
No, unfortunately not. There's no medication that effectively treats or shrinks a hydrocele in adults. It's really a mechanical or fluid balance issue.
Okay. And if surgery, the hydrocelectomy, is needed, what does that generally involve?
There are different surgical techniques depending on the hydrocele's type and size, but the main goal is either to completely remove the sac that holds the fluid or to open it up and invert it, sort of turn it inside out so the fluid can just be absorbed normally by the surrounding tissues.
I see. What about if the doctors aren't totally sure what the swelling is? The notes mention an exploratory operation.
That's right. If the diagnosis isn't clear even after an ultrasound, or if there's a real concern about something serious underneath, like a tumor that couldn't be definitively ruled out, then an exploratory surgery might be recommended. The surgeon essentially goes in to have a direct look and deal with whatever they find.
Okay, so treatment really spans from just watching it to potentially surgery. What's the usual outcome? How do people generally do? What's the prognosis?
It's generally excellent,
Yeah,
especially for those congenital ones in babies that often just disappear.
that's good.
And even for acquired hydroceles in adults, treatment, particularly surgery, is very effective. The chance of it coming back after a proper surgical repair is pretty low.
That's reassuring. Are there any downsides? Any potential complications from having a hydrocele or from the treatments?
Overall, complications aren't that common. If a hydrocele gets really, really large, it can obviously cause discomfort just from the size and weight, maybe affect mobility a bit, or just be a cosmetic issue for the person.
Right.
We've mentioned the rare association with underlying testicular problems like tumors. That's more about not missing something else. Getting an infection in the hydrocele fluid itself is also quite uncommon.
And what about potential issues from the surgery, the hydrocelectomy?
Well, like any operation, there are small risks, although they are infrequent. Things like infection in the wound afterwards. Very rarely issues like infertility or some shrinkage of the testicle called testicular atrophy. You could get a collection of blood, a hematoma, or some minor nerve injury causing numbness. And as we said, there's always a small chance it could recur. even after surgery.
Okay, but generally low risk. We've definitely covered a lot there on hydroceles. So for you listening, the key takeaways really are, it's typically a painless swelling in the scrotum.
That's the main thing.
There are different reasons it can happen, congenital or acquired, communicating or not. And the outlook is generally really good with the right management, whether that's observation or treatment.
Exactly. And it is quite interesting, isn't it, how something that seems relatively simple, just a bag of fluid, can actually stem from different underlying processes. It really underlines why a thorough check is always needed, to make sure you're not missing something more serious hiding behind that swelling.
Absolutely. It makes you think, doesn't it? When might painless swelling actually be a sign of something quite different? And why is that careful assessment so critical, something to mull over?
Definitely.
And if you do want to delve deeper into this topic or any others for your medical learning and revision, make sure you check out pastthemsra.com and also freemsra.com. They're fantastic resources. Thanks for joining us for this deep dive.